We'll be covering Chapter 4, it's medication administration. We will talk about some terms and abbreviations, and this chapter is going to be really important because we're going to kind of talk about your role as a surg tech in medication administration, talk about the 5 rights of medication administration, how we identify meds in surgery, the best way to get medications to the sterile field. Also, we'll talk about labeling of drugs, how to properly handle them, and we'll talk a bit about supplies and how to keep yourself safe when handling sharps. The surgical tech can have different roles depending on what state you're practicing in and the facility. It can even be different from one to another, but it is going to be a critical function of your job in handling these meds. Each team member will have a certain role in the process of how this is done. So it's just important for you guys to be familiar with what you need to do to handle things in an accurate, safe manner. As I mentioned, getting any medication to the sterile field is going to be a team effort. So you guys can serve as a first scrub as a surg tech, or you might be a second circulator. In the room, the circulator, the main one, is going to be a registered nurse, but that doesn't mean that you guys can't help as a circulator. So when you're a circulator, that just means that you're not sterile, you aren't scrubbed in, so you're going to be farther away from the sterile field where the procedure is actually happening, but you can actually still help out. So in the circulating role, this just means that the nurse will obtain the correct medication, and then they're going to deliver that to the sterile field and make sure to maintain asepsis during this time. And then they're also going to be involved in documenting all the medications that are used from the sterile field. When you're acting in the scrub role as a surg tech, you'll be the one that's accepting medications from the circulator. You immediately want to label those, and then when the surgeon's ready for them, you'll pass those medications to him or her. And again, immediately label medications. This is going to be one of the first and most important things you guys need to remember is you want to label, label, label. If medications on the sterile field aren't clearly labeled, they need to be discarded. So if you come in to maybe give a lunch break to somebody and there's medications that aren't labeled, you really shouldn't use them. So many things are clear and look the same. It's really easily mixed up. So you just want to make sure to label, label, label. And then again, if medications aren't labeled, just get rid of them and ask for new ones. For medication errors to be avoided, there's going to be 5 rights of medication administration that have been established, and it's going to be important for you guys to know these. So everybody really needs to work together to accomplish keeping patients safe. So we're going to talk a little bit about these rights. So the first one is the right drug. What drug do we need for the procedure? Right dose, what concentration do we need? Right route, how will the drug be given? Right patient who is receiving the drug, and then the right time. When will the drug be administered? You can also see this in box 4-2 in your book. Now we'll talk in a little bit more detail about each of these 5 rights. The first one is going to be right drug. So this just means you really need to study and look at the surgeon's preference card ahead of time to see what they're actually wanting for their surgery. These can be electronic or they might be handwritten. So you might either have a printout or your facility might have something in place that notes that you can look at to see what they want. And then you always want to also look at the medication's label to ensure that the right drug is used. So you want these 2 things to match. Saying the drug's name at handoff when you're giving this to them, and keeping the vial in the room also kind of help to ensure that the correct medication is used. So if the surgeon asks for local, you can say, okay, 1% lidocaine with epi. And this would just kind of be the first time you're handing it to them that you'd have to say that, but it just acts as like a double check. And then keeping that vial in the room, if there's a question about what you have, you can refer to your circulator and say, hey, what does that vial say again? Just to double check and make sure you are using the right drug. This vial also kind of serves as evidence that the proper medication was delivered to the field. It is really careful though that you guys are cautious when saying drug names. Some drugs may sound a lot alike. They can also be spelled alike. They're going to be easily mixed up, so it's just really important that you're spelling them the right way and saying them the right way so you're not getting them confused. Examples of these are going to be Pitocin and Pitressin. These are going to do two totally different things. Epinephrine, ephedrine, and Tobrex and Tobradex. So you also want to make sure ahead of time that you're confirming with the circulator in the room if the patient has any medication allergies. Typically, before the nurse will bring the patient in the room, they'll tell you if the patient has any allergies to latex, any drugs, anything like that. So then it's important, it just kind of acts as a double check. So if they're trying to give you Ansef and you knew they had a penicillin allergy, then you'd say, should we be using that? Is there another antibiotic? So you guys are just going to be a second source to check. The second right of medication administration is right dose. Dose is going to be a factor of both its amount and its strength. What this just means is the total dose is going to be the volume times the strength. So if you're ever asked about that, that's what dosage is. Obviously, if you're giving something that is like a 0.5% percentage concentration versus a 1%, you could give the same volume of a drug, and that 1% you're going to have given a higher dosage than that 0.5%. So it's just multiplication. You're not going to have to answer any questions about that. But there will be some written protocols at some institutions too that kind of help to eliminate confusions about medications. But again, just make sure you're giving the patient the right dose. So the correct amount, which is the volume, correct concentration. The correct dosage of medications is going to be vital. It's especially important when you're mixing two medications together from your back table. Sometimes you can have the same medication, just different concentrations of them. So you want to make sure you're always labeling each medication carefully. And also your facility may have some different things in place to help you keep this straight. Nurses may be doing the ones actually mixing drugs, so that would take you out of the equation. But it's just going to be really important that you label, and that's going to help to prevent a lot of mistakes that could occur. Another medication administration right is the third one, which is right route. So most medications we're giving are going to be given through an IV by the anesthesiologist in the room, but there are some different ways we can give drugs. So different administration routes are going to require different preparations and concentrations of these medications. You're going to know this based on the preference card of the surgeon ahead of time. So it's going to tell you whether he's going to inject it, it'll be given by anesthesia, that kind of thing. He'll determine the route. Also, you want to make sure that you have the correct formulation of that drug available. Obviously, if he is wanting to give antibiotic in irrigation, you need to make sure that you have saline on your back table mixed up with that antibiotic solution. Another example of this would be topical forms of drugs. Usually those are going to be more concentrated, so you might have a higher concentration of that drug on your field versus something that you're going to inject. So here's a specific example for getting the right drug form. It's going to be important that you carefully read that medication label when the circulator is giving you that. and that way it'll help you determine the route. For example, epinephrine strength for topical is going to be 1 to 1,000. So that is a lot more concentrated, the injectable version, which is 1 to 100,000. Both of these are going to be clear. You can see that from these pictures here, but it's very, very different dosage, and it could really affect the patient in a negative way if you're giving them the wrong drug in the wrong form. So you can see it's extremely important that you're getting the right drug route and purpose. Um, Epinephrine is going to be one that's probably the most important for you to understand concentrations and strengths because you don't want to mix those up because it can cause patient death. So you want to always observe the delivery of these medications to the sterile field from your circulator, and then again, immediately label each drug with its strength included in that too on the sterile field. So the fourth right of medication administration is the right patient. Um, this will just kind of show you some different ways you guys can help ensure that the right medication is given to the right patient. So we always do what's called a surgical timeout ahead of actually starting the surgery. So we're going to identify the patient. We're going to make sure we have the right one in there. We'll verify what surgeon is doing it, what procedure. If there's laterality involved, like right leg, left hip, anything like that, we'll make sure that the patient has stated that and the surgeon has marked them on the appropriate side. And then we also want to check the preference card to make sure we have everything needed. I mentioned earlier that a lot of times the circulator in the room will tell you if there's any patient allergies. So again, this needs to probably be included in that timeout so we can say if they have a penicillin allergy, we're just all making sure that they don't receive any drugs that are going to be harmful to them. Another way that surge techs can help to keep patients free of errors is the fifth right, which is the right time. So this isn't really difficult in surgery because the surgeon's there and he's going to give the medications from the sterile field whenever he wants them given. So it's not like you're trying to time them appropriately. But it is important that these medications are documented in the operative record, is what your circulator will do. But these are just by a verbal order, and then he'll inject them or irrigate with them whenever he feels the time is appropriate. So we mentioned that there was 5 medication rights, but really there's a 6th one I want to mention as well. And there's also this one that was mentioned in your homework, I believe. Um, the 6th right is right documentation. So it's critical that medications are recorded in the op record correctly. And it's also important that you guys are going to maintain an ongoing total of how much drugs are given. This is especially important when we're talking about contrast dye. So you'll use a sterile marking pen that you have just to kind of tally up these numbers. This is just going to be important because typically after these procedures, when you're using a lot of contrast, the doctor likes to know how much because they will put it on the op record. And these drugs can be toxic to kidneys, so that's why it's important to keep a total. Typically what you can do is either you can write down when they inject, like 8 mLs, 10, or for every 10 they inject, make a tally mark, and then you can just add it up at the end. But it's just important that you guys keep an ongoing total of these drugs. Medication identification is always going to follow a certain process. There's steps that we have to do each time, and this will also be listed in box 4.3 in your book. So following a distinct logical process is just another way that as a medical team we can help to avoid mistakes. So we mentioned a scrub and a circulator earlier. So everybody shares responsibility in this process and making sure that there's no medication errors. The circulator is going to be responsible for early steps in this process, like reading the medications label and then reading it aloud to the scrub. And then the scrub will actually do the second part of this. So the medication should only be accepted to the sterile field after all of the steps for identification of the drug have been followed. You always want to make sure to read the label before you accept anything, and then you can label it accurately. It's really important that you guys follow aseptic technique when you're getting medications on your sterile field. They can be packaged in different types of containers, so it's just important that you know each way to get these to the sterile field in an aseptic technique. So this will be something as you guys start a Surg Tech program that you'll learn as well, but it's important just to kind of get the basic ideas behind it now. If you look in your book, figure 8, 4.8 will show you how the scrub Surg Tech can draw up medication from a vial held by the circulator. Um, it's just important that you guys do not touch the rubber stopper. So don't touch that rubber stopper that's on the end of the vial. And then you don't want to touch the plunger if you're not scrubbed in. So when we're talking about circulators drawing up a drug, they don't want to put their hands on the inside of that plunger, and they don't want to touch that rubber stopper on the vial where the needle is actually going into, because that would be a way to contaminate and introduce bacteria in there that you don't want. Also, like I mentioned, unsterile hands should never touch the inside of the syringe plunger because that contaminates the inside of the barrel as it moves down when injecting. Um, so you can see here, they're drawing up a medication. You can't see the plunger, but they just make sure not to touch that. Um, a lot of times when we're doing this, the drugs will come in a powder form in a vial, so the circulator is going to have to reconstitute the drug. So that's why they're doing this. They'll put sterile water or saline in there. And then when you're doing this, there's just kind of a special way so you don't contaminate, which we've already mentioned. There is an example in your book, figure 410, which is called a decanter. So this is a good way for them to get medications to your sterile field, but it gives you a little bit of distance between the two. So they might have this on a bag of fluid and they'll spike it in there, and then they can pour this into your field, and it's just going to give you extra length so they're not hanging their arms or anything over the field. There are times where you will see vials and ampules in sterile packages. So in that case, you're going to be the one that's going to show the circulator, the label, and the expiration date, which makes this nice then because when you're drawing it up, you know it's all going to be sterile because you're doing it on your own. But something to keep in mind when you have a glass ampule like you see in this picture, you always want to use something like a 4x4 or towel, ideally, to protect your gloved hand so it doesn't break and cut you or anything. And you always want to break it away from your body as well. They're not something you're going to see very often in surgery, to be honest, but it's important that you guys know how to open these. I'll show you guys some examples of these different items when we get together on our Zoom call on Thursday, but there's a lot of different things that can be used to hold medications. You might see basins, kidney basins, smaller round basins. There's aseptos, which have like a green end on them that you can squeeze. This can help with irrigation. There's suction tubing, syringes, all different types of things that can hold medications in them. Other things to keep in mind is you never want the circulator to lean over the sterile field. They need to stay back, so not to contaminate anything. And then also, if you have a topical medication on your back table that's only going to be applied to the surface area, those are generally higher concentrations. You never want to draw those up in a syringe because it would be too easy to inject them into a patient, which could be fatal. Most drugs used in the sterile field are going to be clear, so that's why it's really important that you label them, because otherwise they're going to be really easy to confuse. There's no way to look at them and know what's what. The Joint Commission National Patient Safety Goal requires that all medication containers in the sterile field be labeled. So this isn't something that's optional, it's something that you have to do. If you want to look on the next slide, I will show you some pre-printed medication labels that you might find in your packs at the hospital you work at. But just make sure you're labeling anything that can hold the medication. So intermediate storage containers as well as however you're actually delivering to the sterile field. that means a med cup, a pitcher, a basin, as well as the administration item, which would be the syringe. Pre-printed labels are nice because they're going to be the most accurate way to label things. But if you don't have that, that's okay. There's ways around that, and you can use blank labels, steri strips, anything like that available at your facility. Like I said, there's a couple different ways to label medications. Pre-printed labels, again, are the most accurate. You can see on the bottom right of this slide, those are pre-printed labels. So they might say like saline, Ansef, anything really lidocaine, just depending on what kind of packs your facility has, you might have these available. Also, though, you can always use a sterile skin marker, which you'll have in your setup on blank labels. So you just need to make sure you're labeling no matter what. You always want to put the name of the drug, the concentration, your initials, and the expiration date. Consequences for labeling things or not labeling them properly, it can be serious for the patient and the surge tech. So that's why it's so important that you guys do the right thing here and always label, label, label.
You're my pet.
There may be some different things you guys have to do when handling medications as well. Some medications may have to be diluted, some things may have to be mixed up because you have a powder and a sterile solution that you have to reconstitute it with. But that's okay, just make sure everything's labeled and label the final medication too. Anytime you're giving a medication, make sure that you have the dilution or mixture labeled on there. And if you're handling controlled substances in surgery, there are going to be some special cautions required and things you'll have to do. If you have anything left over at the end of the case, ways that you'll have to waste this as well. So some different supplies that you'll need in med administration and surgery. Typically the basics are going to be like a med cup to hold whatever medication you have, a syringe, and a hypodermic needle. By far, the most commonly used syringe in the operating room is going to be a 10 ml syringe. This is pretty much what we use for everything, especially if you're injecting local. You'll inject it, refill it for the doctor, hand it back if they want more. A 30 ml syringe can be used a lot of times for irrigation, especially on like a small hand case, or if you're injecting contrast media to the common bile duct, which is something we'll talk about later. They also do have special syringes for different uses. So maybe you're using them for irrigation, or you'll see a control syringe on the bottom left here that gives them little finger holes so they can do precise injections. If you look in your book, figure 415 will have some examples of different types of syringes. You know, we have anything from a 1 ml all the way up to a 60 ml syringe. And really, until you get out there practicing, you're not going to know the difference when they use different syringes, but the 10 ml is kind of going to be your normal one. If you look in your book for figure 416, you can see an example of a Tubex syringe, a glass carbule, and a needle. The carbule is a glass tube that has a little rubber cap on it. That'll be penetrated by a special needle attached to the Tubex syringe. Typically, this is something that anesthesia uses, and it's not going to be anything on the sterile field. Hypodermic needles, these are what's going to be used to draw up and give drugs. So it'll have three different parts. The hub, so that is the collared part you see in this picture that fits onto the lower lock part of the syringe, so it kind of locks on there. The shaft is the long metal portion, and the tip is the sharp part. These can vary in diameter and length. Pretty much everything we use in surgery is color-coded, so it's going to make it really easy by just looking at it to differentiate what it is. 18 gauge needles are going to be pink, the 22 gauge are gray, and 25 gauge are blue. You're going to know these pretty well because those are pretty much the three sizes we are going to be mostly using in surgery. Also, the common length is going to be a 1.5 inch, but sometimes we use longer needles, maybe a 3 inch if you're trying to get someplace deeper, you know, up in the sinuses and the nose, something like that. But again, you guys will get used to the sizes. It's not something you need to memorize right now. but it is a universal way to identify the needle size by looking at it. And we're talking about gauges. It's a little bit backwards. An 18 gauge needle is going to be a lot fatter than a 25 gauge needle, which is going to be a lot finer. So just keep that in mind too. Um, it's important that you guys are aware of how to safely handle sharps. And this is something that you'll learn too before you even go out into your clinical sites when you're doing rotations in the SurgTech labs. So it's important, you're going to hear this, use needles never need to be recapped, or they should never be recapped. But it's also dangerous to leave a needle just hanging out without a cap on it on the sterile field. So sometimes we also have to refill medications. So how do you get that refilled without taking the needle off? Um, like I mentioned on a previous slide, sometimes we're doing a injection of a local anesthetic and they want more than 10 mLs of that what's in the syringe. So you're going to have to refill it. So there's some safe ways that we're going to teach you how to do this, and I'm going to mention it on the next slide. It's important that you guys know how to recap needles when you get out there. So you want to use a one-handed technique. So you can kind of see in the picture here, um, they're using kind of a scoop method. So they're taking in the syringe and there's the cap there and they have that needle. They're scooping the cap on, using gravity to help pull it on there, and then using that same hand to pull it down and click it into place. There's also a way to do this with what you'll learn is a sharps box on your field. It's like a little red box where you always keep anything that's sharp, that you've used blades, needles, suture, anything like that. And you can kind of use that as well to put the cap in there and scoop it up also. In surgery, you might see that there are specialized self-shielding needles that your facility uses. So these are nice because they'll have a little thing that pops into place to protect the tip, and it keeps you from having to handle them as well. But just know that there's a safe way to handle these things, and you'll learn more about it once you do lab rotations if you get into the program. But again, the book is going to say never recap use needles, but you're going to have to. So it's just important that at some point you're going to learn how to do this. So just a summary, you guys as surg techs are going to identify medications, accept them, label them, and pass them. So it's really important that you do every step here correctly in order to keep that patient safe in surgery. So I hope this all makes sense, and later I will have some videos for you guys to watch as well to demonstrate some of the key concepts here, and hopefully just kind of answer any other questions you guys might have.